My name is Caitlin Barnes and I am a nurse practitioner student at Auburn University. And today I'm going to be doing a 5-minute lecture video on allergic rhinitis. So allergic rhinitis is inflammation of the mucosal membranes of the nasal tract with subsequent mucosal edema, clear discharge, sneezing, and nasal stuffiness. It's caused by any substance or condition that causes an IgE-mediated response. And there's a couple different kinds. First is seasonal, which is usually due to outdoor allergens, such as grass, trees, flowering shrubs, things like that. Perennial, which is year-round symptoms, and it's usually associated with indoor allergens, such as dust mites, molds, and animal dander. And then there's occupational, which can either be sporadic or year-round, and those are caused by the workplace. So things like latex, baking flour, chemicals, certain animals, if the person works around animals, things like that. And then risk factors for the patient. If the patient has other atopic diseases such as asthma, atopic dermatitis, food allergies, things like that, they are more likely to have allergic rhinitis. And then also if there's a family history of atopic diseases as well. Repeated exposure to the allergic substance, tobacco, smoke exposure, pets in the house, as well as houses infested with cockroaches. All those things are risk factors. And then as a healthcare provider, when assessing the patient, first ask them what symptoms are they having, and then when do they occur. So allergic rhinitis is associated with recurrent rhinorrhea with clear watery discharge, sneezing, and pruritus. And then suspect allergic rhinitis if the patient describes a seasonal occurrence with the symptoms. Also ask them about environmental and occupational exposures. So what kind of work do they do? Do they smoke? Do they own pets? Do they have a clean, safe living environment? Those are important. Also associated with risk factors. Ask the patient if they are allergic to any medications, foods, or environmental factors, and then ask them if there's a family history of allergies or asthma. And then when completing the physical exam, a couple things to do. You want to inspect the nasal mucosa. Pale boggy terminates with clear nasal secretions is very common with allergic rhinitis. Also inspect the patient's face. There's what's called allergic shiners, which are dark discolored areas beneath the lower eyelids, and that's as a result of impeded lymphatic and venous drainage. And then also inspect the transverse crease on the tip of the nose, and that's due to what's called an allergic salute, which is caused by long-term wiping of the nose in an upward direction. And then the last thing is inspect the throat. Postnasal drainage is often associated with allergic rhinitis, so look for that. And then treatment options for these patients. Saline nasal spray is helpful to just wash the particles that are trapped in the airway. And then antihistamines are very useful. There's first and second generation. First generation includes Benadryl and Vistaril. Those work very well, but they cause drowsiness, so just remember that when prescribing them for the patient. And then there's second generation, which includes Zyrtec, Xyzal, Allegra, Claritin, and Clarinex. These are the first-line treatment therapy for allergic rhinitis because they don't cause drowsiness. And then nasal steroids include Rhinocort, Flonase, and Nasonex, and those are indicated for seasonal or year-round symptoms. And then it's important to educate the patient. Number one point to educate the patient on is avoidance of the allergen is first-line treatment, so stay away from the allergen. You can also remove feather pillows, change air conditioner filters frequently, remove houseplants, pets, things like that. They can also use a dehumidifier to help, and then stay inside with air conditioning instead of outside in the heat. And then make sure that they adhere to the pharmacological regimen that you prescribe. Thanks for listening.